Good afternoon, everyone, and welcome to the Silver State Health Insurance Exchange meeting that has been properly noticed for today at 1 o'clock. We are teleconferencing between the Grant Sawyer building here in Las Vegas and the legislative building there in Carson City. I don't have any announcements this morning. So do you, Mr. Hager? No. Okay. With that, do you want to do the roll call?
Ms. Edkins?
Present.
Ms. Lewis?
Present.
Dr. Klein?
Present.
Ms. Kerr?
Present.
Dr. Ford?
Present.
Director Wilden?
Yes, in Carson City.
Director Johnson?
Present.
Director Mollenkamp indicated he would be absent. Is there anybody representing Director Mollenkamp there?
No, not today.
Vice Chair Johnstone?
Present.
And Chair Campbell?
Here. Thank you very much. We've got a full board today. We'll open it up for public comment. Do we have any public comment in Carson City?
It doesn't appear so.
Okay, thank you. And is there any public comment here in Las Vegas? Does not appear so. Is there any public comment on the telephone? Hearing none, we'll move on to agenda item number 3, which is the approval of the minutes from September 13th and the approval of the minutes from September 18th. Are there any additions, edits, or changes to the 13th of September? Hearing none, is there a motion for approval?
Marie Kerr. So moved, Madam Chair. Leslie Johnstone, I'll second.
Thank you. All those in favor of the motion?
Aye. Aye.
Okay. Thank you. Motion passes. Are there any changes or edits or additions to the minutes for September 18th? All right. Hearing none, is there a motion to approve?
This is Dr. Ford. I move to approve the minutes.
Thank you. Is there a second?
Second, Lynn Atkins.
Okay, a motion and a second to approve. All those in favor?
Aye.
Aye. Aye.
Sounds like we've got a unanimous decision. Thank you. All right, with the approval of both of those minutes, we'll close agenda item number 3 and move on to item number 4, which is the Executive Director's Report.
For the record, John Hager, Executive Director for the Silver State Health Insurance Exchange. This report discusses the status of exchange implementation, the advisory committees, status of contracts, and the board calendar. On page 2, you see the major events that are upcoming: the blueprint submission, certification, legislative session, go live, which is 355 days from today, and then the first date of coverage in January 1st of 2014. And we are closely counting down those days. So far, the advisory committees have made 25 substantial recommendations to the board, of which the board has approved 22, and you'll see that in the agenda later on today. We have probably another half dozen that will occur in the next several months. After that, we'll move into a regulation making process, and so there's an agenda item today that discusses how the board intends to move forward with the regulation processes. And then finally, the legislative session begins February 4th and ends June 3rd of 2013. And so we probably will be finishing up the regulation process as we move into the legislative session. At that point, we'll have to determine how regularly the board wants to meet for updates for bills and things that might affect the exchange. However, by that point, most of the policymaking and regulation processes for the board should be done, and we should be able to reduce the number of board meetings, hopefully to every other month, maybe even the statutory minimum of quarterly. Probably we'll have some phone-in meetings during the legislative session for BDR updates, for bill draft updates. The technical implementation is moving along. Xerox State Healthcare LLC has been working, it seems like, around the clock to provide us deliverables, documents to govern the way that the project is going to be managed. So in addition to the contract, we have project management plans, quality management plans, things like that that we're going to make sure that the project adheres to those standards. So we've received several deliverables. Some 30 chapters in these plans that are pretty comprehensive, and as we complete them, they'll be sent off to SSHIX, and will probably be loaded on our website as well, so that if you're that curious about it and need some nightly reading to help you fall asleep, you can look at it. We are one of 15 states that are part of what they call exchange innovator meetings. They were previously called early innovator meetings, but now with the various groups that have, or various states that have caught up a little bit with some of the early innovators, they've called them exchange innovators. So we're meeting regularly with staff from SSHIX for those items. We're working on getting information to SSHIX to complete the exchange blueprint requirements. We do not anticipate a need for any additional funding beyond the $74.8 million that have been awarded through the planning and establishment grants. Going on to the advisory committees, 2 committees, the Finance and Sustainability Committee and the SHOP Committee, have completed their work, and the board has finished the approval process for those recommendations. The remaining 3 committees should be able to finish their work in the next month to 3 months. Consumer assistance might lag a little bit further as we go through the appeals process and some of those items. And so as those policies are completed, then we'll move into the regulation process if it's necessary for those policies. So the committee calendar for the next several months is on table 1 on page 4, obviously subject to change. The status of the contracts, we have negotiated contracts with 3 consulting and actuarial vendors, and we'll talk about that in a later agenda item, to go to the November BOE Board of Examiners meeting. Auditing services, we have elected not to pursue a contract with a vendor for auditing services. Instead, we will we have engaged the Division of Audits, Division of Internal Audits with the Department of Administration, and they'll be providing our audits at least for FY12 and FY13. Once we start getting into the financial transactions with the web portal, at that point we'll have to have some more robust financial monitoring, but at this point it's simply a matter of us following state rules, being in compliance with the auditing standards of the state, and so the Division of Internal Audits will do a sort of a focus audit on us to make sure that we're in compliance with all of the regulations and statutes and rules and accounting rules. We also currently have a marketing and outreach services RFP number 3006 that has been released, and bids are due November 1st. We expect that RFP will go probably to the January BOE for approval, and then the calendar for the board is on page 5 and 6. And with that, I'll be happy to take any questions.
Do any of the members have questions for Mr. Hager? Doesn't sound like any. Thank you for your report. We'll close that agenda item and move to item number 5, which is the discussion and regarding regulations for the exchange. So, thank you. I'm sorry, Mr. Hager was just letting me know that Mr. Roos was going to take care of this today. So, and I would expect we have Mr. Belcourt with us also to answer questions.
Yes, Madam Chair.
Okay, thank you. All right, Shauna, go ahead.
Thank you. For the record, Shauna DeRoos. The purpose of the report that we've provided today is to give you a brief overview regarding the regulation process, and there's a very specific narrative that John mentioned that is attached to this item that we will leave for your nighttime enjoyment reading. But this particular document will go over a brief overview of the regulation process as put forth in NRS 233B, and then what the staff recommendation is for this board to go forward. The exchange is one of 14 departments and agencies that is exempt from NRS Chapter 233 rulemaking requirements. And although we are exempt, the board has committed to an open, transparent process for the establishment of the exchange. And the regulation process as presented in this document would allow for that to be followed as closely as possible. If you look at page 2 of the document under what is a regulation, a brief description is that a regulation is defined as an agency rule, standard, directive, or statement of general applicability which effectuates or interprets law or policy or describes the organization, procedure, or practice requirements of any agency. So basically, that's very legalese to say that these are the rules that we will follow and that what other people will follow in order for us to accomplish the goals and mission of the exchange. The term regulation, there's a list of 13 different items here that regulation does not apply to help give you some sort of a place of where a regulation would fit. The necessity for regulations for the exchange, again, as we've said, we intend to issue procedures based on the board's policies and decisions and to keep regulation to a minimum. However, regulations are required to be set in certain, to set certain standards and minimize appeals. And rulemaking may be used as a tool for fostering better understanding of the legal requirements of the policies of the exchange. We have consulted with Dennis Belcourt, who's here today to answer questions, and have identified several topics for which regulations should be created. These include carrier fees, qualified health plan standards, certification processes, recertification and decertification, advertising standards, enrollment and eligibility appeals, and reinsurance, if applicable, if the board makes that decision. So the regulation...
Pardon me, is there any chance we could get closer to a microphone? It's hard to hear on the phone.
Yes, I'm sorry about that.
No, thank you.
The regulation adoption steps include that we would draft the regulation, we would discuss the content of that regulation with the board. Usually this would be submitted to the LCB, the Legislative Counsel Bureau.
Excuse me, but it's worse now. This is Lavon Lewis in terms of the sound. So if she could really get closer to the microphone, might be able to hear better.
Miss Lewis, I think she's about as close to the microphone as she can get. It may be more a telephone connection than the connection that we're receiving from her.
Okay. Okay, thank you.
Excuse me. We would prepare an impact on small business statement to consider the impact of the regulation on the small businesses in the state. I think we've been doing that throughout the last 8 months, but we could provide a statement that would explain that in detail and the methodology that we use to come up with those impacts. We would conduct workshops. At least one workshop would be required so that people could come in, discuss the general topic, discuss the proposed regulation before the language is actually drafted. We would post a notice of intent to adopt the regulations. This would go out at least 30 days in advance. We would then have that public hearing. This could be during a board meeting or separate. We would have consideration of public comment. These could come in person during the workshop or the hearing or in writing. And then there would be a final adoption of the statement, the regulation as drafted or amended. So the regulation adoption steps that the exchange staff has recommended is very similar to this. Draft the regulation. The staff will draft regulation in consultation with the exchange deputy attorney general. All the regulations will be in accordance with the policies and recommendations approved by the board. We would submit that to LCB. We would submit a draft of the rule to the Legislative Council and State Library and Archives Administrator. There would be a copy available for public inspection. And right now, due to the timing of the current regulation requirements, it is not expected that the Legislative Council would be able to assist the exchange with this regulation. We would consider the impact of the regulation on small businesses, as I discussed earlier, drafting that brief statement. We would provide a 15-day notice of intent to conduct a workshop with interested persons. This notice would be posted in all the locations that a board meeting would be normally posted. And the workshop, we recommend that it would be during a normal board meeting. We would have a notice of intent to adopt the regulations. As I said, this would be a 30-day notice of the hearing. We would also recommend that this be during a board meeting. These posted items go to the State Library and Archives Administrator. It gets posted with the librarian of the main public library in any county other than Carson City. And the Legislative Council Bureau would also have it posted for inclusion in the Register of Administrative Regulations. We would have the public hearing, we would consider the public comments, and we would adopt that regulation and have the final adoption where it would be filed with the Secretary of State and other applicable agencies. So to give as much time as possible to the carriers to begin their rating processes, staff proposes a workshop for the rate setting process at the November board meeting. We would have to post that meeting no later than, I believe, the 18th of October in order to make that happen. Depending on the work of the Consumer Assistance and Advisory Committee and the Risk and Reinsurance Advisory Committees, the eligibility, appeals, and reinsurance regulations may be delayed, and we would have to have a separate workshop and separate hearing for those items in the future. So the recommendation is to approve the regulation adoption steps as I've laid out here, or provide guidance regarding any timeline the board may desire. Thank you.
All right, I'm going to open it up for discussion from board members.
Madam Chair, if I might, this is Terry Johnson.
Yes. Yes, Mr. Johnson.
I had a question for the Attorney General's office with regards to the exemption to Chapter 233B. How does that operate with regards to the process the exchange is taking or proposing to undertake to adopt regulations? What exactly does that exemption mean in comparison to the steps that are proposed before us, and what we would be required to do and what we might be exempted from doing?
Madam Chair, thank you, Member Johnson. The statute that deals with applicability in 233B, that's 039, entirely exempts the exchange from applicability of 233B, which means none of the rules are applied, are required of the exchange. So strictly speaking, I mean, the open meeting law is a requirement that would still apply to the adoption of rules. But in the exchange, I think in exempting the exchange from the rules, as with other entities, the intent wasn't necessarily that the exchange could not follow the rules. It could choose which rules it needed to follow. The intent, I believe, was to provide flexibility given the time constraints that you face in terms of going live. So there's no requirement that you follow those rules. I think that as Ms. DeRusse laid out and she laid out the procedure for that it tracks 233B, but would exempt. Well, right now, most agencies would have to go through a temporary rule-making process if they wanted to be assured of getting a rule done fairly quickly. That would only be valid through to November 1st next year. This allows you to adopt. The exemption allows you to adopt permanent regulations without concern for whether LCB can get back to you with an approved set of rules, because they will not be required to go over your rules, and they, as many of you have, are with agencies that do rulemaking, you understand that the process is that they can change the language and so forth. So the language, this gives the agency flexibility. In other words, I don't know if that's too long-winded of an answer, but there really is no absolute requirement other than 241 open meeting law, and also I would say there's basic constitutional due process issues of you have to have a regulation published for people to read before you can hold them to adhering to that regulation. So those kind of rules outside of 233 would be applicable. Thank you.
All right. Thank you, Madam Chair.
Madam Chair, this is Mike Wilden.
Yes, Mr. Weldon?
I just wanted to note for the record, if it gives anybody any comfort, this process is very similar to the Health and Human Services process. We have 6 divisions that are subject to rulemaking, promulgate rules, and 2 of those 6 divisions are exempt from the ACA, that being the Medicaid agency and the Welfare Division, and the process outlined by Mr. Roos is pretty much to the T what we follow also.
Thank you. Mr. Belcourt, I have a question for you because, I know when the board first adopted this policy that we were going to try to adhere to 233B as much as we could. You hit on it a little bit when you said if you were in an agency that was not exempt, you would be adopting temporary regulations. I think for clarity of the record, I think we need to make it clear that we will not go through that temporary process if that's, if we're trying to get something finalized by January, and that this will be a permanent regulation. Is that correct in the thinking that's being proposed to us?
I believe that's correct. The agencies under 233B can go through permanent rulemaking in this period, but there's no guarantees it'll get done in a timely fashion, given LCB's workload. So, but yeah, that's my understanding. Is the purpose of the rules as laid out in your materials that this agency would like to follow would be to adopt permanent regulations. You could choose to not adopt. You could choose to adopt regulations that did not have permanent force and effect, but that's my understanding, is that you would want to have that option or to do that.
So I think that's a discussion that the board needs to have as to what type of regulation that we're going to be entering into, whether we're considering it temporary, which has an expiration date on it, or if we want to go to a permanent regulation. I think, and the other part of this, in the reading of this, are you anticipating that this would go before the legislative subcommittee to review regulations?
There's no requirement of that in the law, and I'm not sure that whether that's done with other agencies that are exempt, that they pursue that as an option, because the Legislative Commission doesn't need to approve of these, and technically there's no provision that they be filed with the Secretary of State in the statute that I'm aware of, where 233B does require that. I know that Corrections publishes their own regulations online. They might file them with the Secretary of State, but I've never seen them filed there. So there are a lot of requirements under 233B that might not be applicable, because simply the agency that, such as the Secretary of State's office or else LCB, are not, it's voluntary or an option for them to review, but it's not a requirement for these to become rules.
Okay, and again, I think that ought to be a discussion point here. If the final step in this, under our consideration today, is approval by this board, then it would immediately be filed with the Secretary of State and would not go through that legislative review process, which can be lengthy, particularly if you think that it's during a legislative session. But I just want to put all of this on the record so that people can see if we're going to deviate from the norm because we are exempt, and where are we going to deviate.
Madam Chair, if
Do we have any other
follow
Yes.
up? That was kind of my line of inquiry as well, that maybe Mr. Roos can clarify for us. So it looks like you've prepared a checklist here that seems to be pretty well aligned with the Administrative Procedures Act, Chapter 233B. So are there any instances in which you've proposed that deviates or takes advantage of that exception, or are we proceeding just to be safe with the requirements of 233B, and then if there are circumstances that might arise in the future where we might need to quickly adopt a regulation or set forth some rate changes or what have you, we would avail ourselves of the exemption at that point. In terms of deviation from the Chapter 233B, are there any in what you've proposed today?
For the record, Shauna DeRose, I think that the number one deviation, as you stated, was that it would not go through the pre-review of LCB. It would not go over there, have them review the language, change the language, and then bring it back to us. We followed the NRS 233B after that point as closely as possible. And again, as you said, to keep us very nimble and able to react to any changes that might need to be made in the future. We may have to sidestep even more of these. And I think that was the whole intent of making us an exempt agency, that we were able to get through this process quickly because of our time constraints. We simply don't have the time that some of the other agencies to go forth to make this work by the time our regulations need to be in place to get us started.
All right. Thank you, Madam Chair.
For the record, John Hager, just to follow up on that. So again, to reiterate Shauna's point, that we're going to send it to LCB just like anybody else would, but we're not going to wait for the response from LCB for several reasons. But the number one of which is, well, I guess the reason is the timeliness, being able to get this done so that carriers can have the information they need to move along. The other part of that could take time is going to the legislative subcommittee. And so both of those two processes, we wouldn't wait for a return. But otherwise, we are following the steps of the Administrative Procedures Act. We do think that it is important that the public have a chance to discuss these items, to provide their input, for the board to consider it. And so we do think that the 15-day notice for the workshop and the 30-day notice for the hearing is appropriate, and we can still get the job done within those time frames. When you add on the LCB review and return of the regulations in the midst of getting ready for a legislative session, that's just going to be, I think, too difficult to get done, as well as going to a legislative subcommittee for the final adoption.
Well, and I would agree with the statement that I think that's why the legislature intended us to be exempt. I think it's very clear that this board is trying to be as transparent and follow the rules that we're exempted from, but in an effort to get things solidified so that the carriers can get out and start doing what they need to do for the exchange. I'm going to reiterate again, I think I see three exceptions here. One, because of the timing. We're looking at a permanent regulation rather than a temporary regulation. Two, we are going to submit to LCB, and I would hope that there would be some dialogue between the Attorney General's office and LCB to let them know what we're doing and what our time frame is as a courtesy to them. And then lastly, we would not be submitting to the subcommittee for review of regulations. If a regulation was adopted by this body, it would then be just filed immediately with the Secretary of State and then would actually be enforceable at that point in time. So does that, I'd like to open it up for discussion among other members, particularly the attorneys that are sitting with us that probably have walked through this process, and some of the agency heads that have done that with it too.
Barbara, I appreciate your comments. This is Marie Kerr. And I think that you've pretty much covered the exceptions process. And, you know, NRS 233B, we should always follow, of course, as if we can. But if we can't, there's always those emergency situations, especially with this board, as we are in the process of creating something. And I think you've covered it. So those are my comments.
Madam Chair, this is Leslie Johnstone. It sounds like while we're exempt from 233B, we are being consistent with how other exempt agencies, such as Mr. Weldon's areas that he noted. So I don't think we're out of the norm entirely, but we're being, sounds like, very consistent with other exempt agencies.
And I might just make one other comment. If for some reason something needs to be changed in a regulation, all you have to do is notice a reopening of it. So it's not a real lengthy process if we find that something needs to be changed within an existing regulation. All right, so Mr. Belcourt, do we need to have an approval and a motion to approve what we've talked about here today? Or just a consensus vote?
Well, I'm looking at co-counsel, our open meeting law expert, and I think we do need to have a motion that to approve.
Marie Kerr, motion
This is
to approve.
This is Leslie Johnstone. I'll second.
Is there any further dialogue? Okay, all those in favor of the motion?
Aye.
Aye.
Any opposed? Motion carries. Thank you very much. All right, Mr. Roos, is there anything else that you feel that we need to cover under this agenda item?
No, I believe that is fine. Thank you.
Okay, thank you for your report and your explanation. I appreciate it. So we'll close agenda item number 5 and move to number 6, which is discussion and ratification of a consulting and actuarial vendor selection. Mr. Hager, is that yours? Or Mr. Roos, it's back to you again.
It is. Thank you for the record, Shauna DeRoos. On October 10th, the Nevada State Purchasing Division, on behalf of the Silver State Health Insurance Exchange, released a request for qualifications, number 1999, for proposals related to consulting and actuarial services regarding the implementation of an Affordable Care Act compliant health insurance exchange. As you all know, we have utilized numerous consultants and firms to get us to where we are today, and they've done a marvelous job, and we've relied on them. When we started this process, we kind of piggybacked onto a contract that was in force at the time at Health and Human Services, with the intention that we would have an RFQ or an RFP going forward so that the selection of vendors would be in an open and transparent process. So that's why this particular RFQ was created. The purpose was to create a pool of vendors so that when we needed that outside consultant help, that we could go to the best person or best company at that time to ask for those services. We were looking for services for general management consulting, for actuarial planning, design, development of an exchange, people who've had the experience out there, insurance market reforms, development of the finances and the plans to put this very, very intricate plan together of creating an exchange. We needed services also for actuarial services, analysis and interpretation of benchmark plan data, refinement of population data, and we got a very good response. We got 12 responses back from that RFQ, and vendor responses were scored based upon demonstrated competence, conformance with the terms of the RFP, the expertise and availability of the key personnel, references, and their cost. On September 11th, the purchasing division had an evaluation committee meeting, and there was representation from the PEB, Public Employees Benefits Program, staff, as well as the exchange staff. The evaluation team, they met on the 19th. They considered the proposals and chose the top 3 scoring proposals to perform those services for the exchange. And those contracts will include Milliman, Public Consulting Group, and CSG. The contracts were put together and would go to the BOE on November 13th with the board's ratification. Each vendor's contract, we used a $500,000 not to exceed. This is authority, so that authority would be there when we needed that pool of services, and is in no way a guarantee of actual use for that contract. So the recommendation is that we ratify the evaluation committee's recommendation that the exchange contract with Milliman, Public Consulting Group, and CSG to provide consulting and actuarial services.
All right, thank you, Mr. Bruce. I'll open it up for discussion among board members. Ms. Atkins?
Lynn Atkins for the record. I just have a couple questions. Why are we selecting 3 contracts to enter into? Do they all have different expertise? So I just want to know the reasoning behind that. And then if we do have 3 agencies that we have contracts not to exceed $500,000, who decides which agency we're going to use? Are we going to exhaust one contract first before we go to the next? Kind of just how does all this work, having 3 multiple contracts?
For the record, Shauna DeRusse, those are very good questions. Thank you. There is not an intention to exhaust one contract before going to another. Several contractors were chosen just because availability, as you said. The market is getting very crowded as more and more states are coming into the exchange arena. Many of these vendors are working for several different states, and so as we reach out and need services, we wanted to make sure that we had a pool so that if someone was too busy or they didn't have the availability of their staff at that time, we could either go to the next company, or if there is a particular expert at an organization, we could go to that organization. The Public Consulting Group is more on the general contracting consulting side, and both Milliman and CSG are available to provide actuarial services as well as consulting. So we felt that within these 3, it gave us a pool that could provide actuarial and general consulting and would give us the best chance of having someone there when we need them.
Thank you.
Are there any other questions from board members? Okay. If there are none, what is the pleasure of the board?
Lynn Atkins for the record. I know Mr. Hager's not going to like this for a moment. Can we defer the approving this, the contract portion until after we talk about consumer assistance? There's a lot of kind of contract and dollar amount issues that I think we're going to bring up, or I'm going to bring up in my report, and before we kind of sign off on a $1.5 million contract here, I think there's some concern at the consumer assistance and that there's not enough money designated in that, and I'm not sure how the money can get moved around, if it can, but before we do that, I would ask that we talk about consumer assistance first.
Do any of the board members object to moving this down further on the agenda? Hearing none, let's put this item on hold for a little while. We'll bring it back before the close of business today. And we will move on then to agenda item number 7, which is the recommendations from the advisory committees. Finance and Sustainability and Plan Certification have no new recommendations. And that turns it over to Consumer Assistance and Ms. Atkins.
Thank you. Before I start, I guess I just wanted to preface going over the report with our committee met numerous times to discuss navigators, brokers or producers, consumer outreach specialists. We had lots and lots of public comment from the broker community, the consumer advocate community, and really, I think, thoroughly went through the issues before us and hopefully produced no pun intended, produced, hopefully came up with a document that, and some parameters on everyone's roles and responsibilities that will be as clear as can be. But I did want to just publicly thank everyone who's on the Consumer Assistance Subcommittee for all the work that they have done, that they are continuing to do. We have a lot of big issues before us, and everyone who has participated, again, by public comment, coming to the meetings and sitting and listening. It's been an interesting process. So with that, I'm going to review document, is it 7B? Is that right? It's the 14-page document. I'm not going to read all 14 pages. I'm not going to go through the background in detail, but I think the core part of the background of this is that the Affordable Care Act requires the use of navigators in health insurance exchanges, and that's been a challenging issue to get everyone's heads around, that navigators are required, and we had to figure out how they were going to be best used within the rules of the Affordable Care Act, also including the broker community and then the new outreach specialists. So if I can just start with that. And the Affordable Care Act requires the Navigator program and the navigators to conduct public education and activities. I'm on page 2. Distribute fair and impartial information concerning enrollment, facilitate enrollment in qualified health plans, provide referrals to any applicable Office of Health Insurance Consumer Assistance, provide information in a matter that is culturally and linguistically appropriate to the needs of the population being served by the exchange. So we developed parameters for the navigators. I think what I'm going to do actually is go from the agenda. That navigators are going to be certified by the Division of Insurance. They're going to be compensated by the exchange through a competitive grant process, and they're going to enroll individuals in qualified health plans. And I'm reading now from the agenda on page 2, because that really is just the crux of what the navigators are going to do. I'll go back in detail in just a moment. The producers, who are the broker community, are going to be allowed to enroll individuals in qualified health plans, will be licensed in the same manner as they are today, in addition to exchange specific information for licensing and training, continuing education, and will be compensated by carriers in a similar manner as is done today, or as determined by the carrier and the producer. And then the third category, which was included, are outreach specialists, which can be funded by Affordable Care Act funds from the federal government. They will provide outreach and education generally in group settings, will be employees, contract employees, or grantees of the exchange, and will be trained, tested, and certified by the exchange. So that is the really bare bones summary of the 3 different participants in getting people signed up for the health insurance exchange, for the healthcare exchange. On page 4 of 14, I'm going to go through the roles and responsibilities of the navigator. The navigators are going to be responsible, as we said, for outreach, education, and enrollment for the currently uninsured or underinsured populations. Present those populations the options available under the Affordable Care Act. This outreach and education will include information regarding the Affordable Care Act as it relates to the exchange, including but not limited to program eligibility, methods of purchase, reasons to purchase, definitions of health insurance terms, dispute resolution, cultural diversity, group outreach opportunities, access to enrollment localities, answers to enrollment questions, explain eligibility criteria, provide documentation regarding the plans, enrollment letters, date of coverage, and furnished unbiased explanations of coverage provided on the web portal.
The enrollment navigators must not offer any opinion or editorial on the qualified health plans in the exchange. Information provided by navigators must be limited to that information available on the web portal. And I think that's probably the clear line that we have been talking about. The minute somebody asks, what should I do? What plan should I pick? Then that is turned over to a producer. So that's where we kind of saw the line. The navigator certification and training, this was another big discussion at the subcommittee meeting. I think the agreement was that the navigators are going to be licensed or certified at a level less than producers. There was concern that if navigators are required to be certified or licensed at the same level of producers, it would prevent people from becoming navigators, and we need navigators to make this work. And so what the portion that I do want to wait until the next committee meeting is the certification and training of navigators, a better framework of what the certification and licensing requirements are going to be is going to be brought back to the Consumer Assistance Subcommittee meeting. So that portion of it, I think we are going to delay until the next committee meeting. Navigator compensation, they will be funded through a competitive grant. Potential navigators will submit applications requesting consideration as a navigator. On page 6, there is a discussion of what the application to apply as a navigator should include. At the bottom of page 6, which is one of the items that I do think we need a more discussion on, is right now the exchange has budgeted $380,000 for navigator grants for each fiscal year. $285,000 is expected to be paid out between July and December. There is serious concern with our subcommittee that that isn't anywhere near enough money for the navigator program to get that up and running. So that's a discussion that I'd like to have today as well. Page 7, navigators cannot have conflicts of interest, and then navigators will monitor available enrollment metrics so the exchange can provide reasonable future improvements to the system. So that's the navigator section. The producer section starts at the bottom of page 7. Producers will continue to play an important and influential role in the distribution of health insurance. Both individuals and consumers and businesses rely on producers to sort through their health insurance options. Producers in Nevada serve hundreds of thousands of policies currently. The role of the producers in the exchange is going to enroll individuals and employers in the qualified health plans through the exchange the same way that producers who sell insurance products in pre-exchange market. They will continue to provide individuals and employers with information regarding health insurance and assistance in enrollment in health plans. Additionally, many full-service brokerage firms provide assistance with claims and billing issues, assist employers in the creation of complete benefit packages. Producers are encouraged to continue to provide these value-added services to individuals and employers. Producers will also enroll individuals through the exchange so they can and they will need to understand the basics of the exchange web portal, advanced premium tax credit, structure of small business of the shop exchange, Medicaid enrollment, and where to direct individuals who require social services from programs such as SNAP and TANF. The licensing and certification will continue to be managed and monitored through the Division of Insurance, and there's going to be some additional training requirements added on to their current training so they understand all of the things that I just read off regarding the exchange. Page 9 of 14, I think we see a lot of edits. Again, I think we're going to delay the actual hours and exact certification requirements for the producers as well, which will be in addition to their current licensing requirements. Producer compensation, they will not be compensated by the exchange. They'll receive compensation from carriers for enrollment in the exchange in accordance with the producer's contracts with the carriers in the same or similar manner as is done today. These contracts are outside the purview of the exchange. However, the exchange enrollment system will accept the producer's national producer number, transmit that data to the carrier so that the producer can receive commission directly from the carrier. It's the producer's responsibility to make sure they're appointed with the carriers on the exchange to receive compensation. The outreach specialists are the third and final category, and they are going to give presentations primarily in the more difficult to reach communities, in the rural communities, and the areas where there is a higher number of uninsured. They're going to go through program eligibility, methods of purchase, reasons to purchase, definitions of health insurance terms. They'll be conducting group outreach opportunities, explain the exchange and its governance structure, explain essential health benefits, and explanation of expanded or changed coverage as a result of the Affordable Care Act. They will be certified and trained again in some fashion, and that will be part of what's going to go back to the Consumer Assistance Committee meeting so we can figure out the different licensing and certification requirements, both in partnership with the Division of Insurance. Again, there's concern on page 11, 6.3. The exchange has budgeted $200,000 to pay outreach specialists. Approximately $75,000 is expected to be spent on the program July through December, $65,000 January through June, and $60,000 July through December 2014. It just doesn't sound like enough money. So page 12. And part of 13 is a summary. Again, if I could just highlight the navigators training, it says it will be similar to that of producers. Again, the training and certification is going to be brought back to the Consumer Assistance meeting to work with the exchange and the Division of Insurance to ensure that both the public is protected by navigators, that they are going out and doing and explaining what they are supposed to be explaining, but also limited to a level that we are going to get navigator applications from people and organizations that want to be navigators. So that being said, I guess the only other discussion I wanted to have about finances is both the budget for the outreach specialists and the navigators seem low, and I think in light of the current advertising and marketing budget for the first year, which looks like $3.7 million, I just think we want to make sure that we get the word out. We have an incredible campaign that gets people to the exchange to sign up, but that we also need the boots on the ground. And how much money is enough to have boots on the ground, I don't know. But those figures just seem low to me. So with that, I forget anything.
Thank you for your very comprehensive report and for all the hard work that you've done chairing this committee. We all appreciate it. What I'd like to do is open it up for discussion between the board members, and then I will open it up for public comment before I ask the board if they have a desire to make a motion on this recommendation. So, Dr. Klein.
Yes, Ron Klein for the record. My concern is that in order to be a navigator or an outreach specialist, you must be paid by the board, by the health insurance exchange, which I think could potentially be limiting if we have any kind of budgetary problems. So the question is, if a community organization wants to train, go through the normal training process, but employ an outreach specialist or navigator using their own funds, is that allowed based on the recommendations?
For the record, John Hager. So for the outreach specialist, they would not be considered an outreach specialist. An outreach specialist is very much under the control of the exchange. For the navigator functions, you do have the potential to be able to do that using their own funds. Because we're going to be using the Division of Insurance and they've got their licensing processes for the producers, we could use those same processes through a certification or licensing light or however you want to call it to certify the navigators. They could be certified as navigators by the Division of Insurance, but not actually get paid grant funding. So that's something we can work out with the Division of Insurance. The other part to that is while we intend to award grants to entities that can provide the functions of a navigator, at least the way staff was looking at it, was that we wouldn't necessarily be paying whole salaries for navigator efforts. There are entities out there that go give presentations or do things in the rural areas, so we could pay 10% or 25% of a salary to add on the functions of the exchange when they go out to those rural locations. There could be entities that that have outdated computer systems, and if they could have funding to upgrade their computer systems so that we could provide our web portal on that computer system, and they certify their employees to become navigators, they could do that as well. So the funding wasn't, the way we had envisioned the funding was not that it be straight to salaries, full-time positions. It would be split up among various groups, but I'm not sure what exactly would be adequate.
So the verbiage under 4.4, just as an example, says all navigators participating in the exchange will receive funding through a competitive grant process. So there's nothing in that verbiage that says if a community group wants to pay its own navigator, they can still participate in the exchange. And I think that's throughout that document. So I would just want to make sure that if a group, a community group, as a community service to its members, wants to train its own navigator and fund that navigator, that's allowed under our rules.
Dr. Klein, for the record, this is C.J. Bowden. To address that issue, the navigators are specifically called out in the ACA, and to be a navigator, you have to get grant funding from an exchange that is not ACA funds. So any other group could go and train their own outreach specialists, their own navigators. They could call them whatever they wanted, but they would not be an ACA exchange navigator. So they could do other groups could put people in those positions, but it wouldn't be a true navigator because of the way the law is written.
And I'm sorry, if I may, this is Shauna DeRoos for the record. One additional point of clarification is that navigators cannot be paid with the ACA funding, but the outreach specialists definitely are. So I think I heard that they were both paid with the funding earlier, and they are two separate funding streams for those two different type of entities.
I was going to say and I haven't seen the ACA exact language, but the ACA specifies navigators, but we felt comfortable in changing those designations and calling them producers and navigators and outreach specialists. So I just want to make sure that, again, my bottom line is that if an organization wants to do this, that they're not in any way limited. And what you're telling me is that's not the case. They're not limited.
For the record, C.J. Bowden, throughout this, the navigators are actually only one entity. Producers are current brokers and agents in the insurance community that will be participating in the exchange, and outreach specialists will be looked at as an employee of the exchange, trained and paid for by the exchange to go out and give presentations. So there's three different levels, and the navigators actually haven't been broken up. They abide by what the ACA has in place for regulations and roles on navigators.
Lynn Atkins, but now it's starting to sound like if there's not enough funds to fund navigators, and yes, I understand that you can use federal funds for the outreach specialists and you cannot use federal funds for the navigator, but if that another organization doesn't want to submit a grant application, but they can just kind of call themselves, non-ACA navigators, I mean, that sounds like we're starting to kind of lose control of the message and helping people. This is starting to sound very messy to me.
For the record, C.J. Bowden, to address that situation, we really have to look at the fact that to be a person that enrolls in a qualified health plan in the exchange, you have to be one of two things: an exchange ACA navigator through the exchange, certified by the Division of Insurance, or a Nevada producer, which would be an agent or broker, licensed by the Division of Insurance. Those are the only two people that can enroll. Another group could go out and do outreach efforts. Enroll America is a prime example of an agency or a company that's doing outreach efforts now. They're going to be advertising, and they're going to be teaching people about the ACA and giving them information on places to go to sign up for the insurance or ways to access the web portal, things like that. They're not going to be doing actual enrolling or enrollment efforts. That's where our fine line's drawn. You either have to be an exchange navigator or a licensed producer in the state.
For the record, John.
Yes, Ms. Lewis?
Well, what I'm hearing then, when these outreach specialists go out into the rural areas, they will then have to refer, and I assume from what you're saying, they're not going to go into urban areas, they're just going to go into rural areas?
No, the outreach specialists are going to be statewide, and outreach specialists will not be enrolling a person. They're going to be giving a presentation on the ACA. If a broker, licensed producer, wanted to, or a navigator wanted to accompany an outreach specialist, that is the person that could do the enrolling. The outreach specialist is not going to be doing enrolling. They're going to be out there getting the word out on how to comply with the law, and they're going to be educating the people on the exchange and the new things because of the ACA.
Lewis again. I would certainly agree with Ms. Atkins and saying that there does not appear to be enough money for navigators included in the budget, because if we look at enrolling 100,000 people the first year, and if we assume, since much of what we're saying is based on assumptions, that 1/3 of those people would go to a navigator, or would be looking to a navigator to assist them, then we would be looking at some minimal cost per person that would accrue to this organization that's going to have people trained, put in the necessary equipment to be able to assist navigators. And I think that is that expectation that there would be a number of organizations that would be willing to do that. It would be presumptuous on our part. I really think that we do need to increase that amount.
This is Marie.
For the record, John Hager.
We have two people talking right now. Let's have Marie Kerr speak, and then Mr. Hager can respond.
This is Marie Kerr. Mr. Hager, a couple of questions for staff. One, how did staff get at its numbers for the grant funding? And I'm assuming, I think, and which leads to the next question is, how much do other states pay for such grants, and how much have they, or rather, how much have they allocated? Are we doing something that's commensurate with other states? Is that where we got our numbers from? Thanks.
For the record, John Hager. So a couple of things. First, I think I got us a little off track when I said that if you're a certified navigator with the Division of Insurance, you could just enroll people, and that kind of confused us. Dr. Klein, you're correct. This says all navigators will be paid for by the exchange, as Mr. Bowden pointed out. There's a couple things that a navigator must do. They must be certified, and they must have they must apply for a grant to become a navigator. And so if they do something that is not appropriate for a navigator, they can lose their certification and they can lose their funding. So you are correct, and I misspoke in the beginning, so that kind of got us off track on that side of it. On the other side of it, the budgeting amount, we looked at the budget for the SHIP program, the State Health Insurance Program. I believe I think that's what it's called. They provide services for individuals to enroll in Medicare D. So I believe that started in 2005-ish. Their budget is about $250,000 a year, and so we modeled it after that. We gave it half, 50% more, something like that, which is about how we came up with $380,000. What was the other question?
Sorry, Mr. Hager. Is that commensurate with what other states have allocated towards their grants for their navigators and outreach specialists?
Lynn Atkins, for the record, and Mr. Bowden can chime in as well. The exchange was kind enough to send me I think it was last week, to a consumer assistance seminar last week, and one of the things that we learned, and I think we're ahead of everybody again, so I think it's hard to say what are all the other states doing, so we're just ahead of everyone. But I believe it was Arkansas has decided to front load their federal dollars to the outreach specialists, and they're budgeting, I believe, between $4 and $5 million for the outreach specialists for the first year. And then the outreach specialists will scale back after the federal funding is gone. So, but even as Mr. Bowden was talking about, when we're saying, oh, the outreach specialists are going to go to these communities and give seminars and do whatever it is, we have $75,000 in the budget for the first 6 months. I'm not sure who these outreach specialists are going to be. Both of them or one of them. I don't know if that would include benefit. These numbers just seem so small for boots on the ground.
Madam Chair, this is Leslie Johnstone. I think everybody's got the same gut reaction to the dollar amount, but I would assume that there is a work plan that has been drafted or is coming that's in more detail than the long list of possible approaches that we had in one of the earlier board reports, maybe last month, where we kind of have a tentative schedule of outreach sessions, group and individual, by location, by month, or by week, so that we can build this from something rather than top down come up with a dollar amount. So I would just put that out there, if it's not already in the works, that would be something to base an estimate on rather than everybody's gut feel about whether this is the right amount or not.
Oh, I'm sorry, Ron Klein. Could somebody explain to me what enrolling means, since that seems to be another bright line that an outreach specialist can do one thing, but only so-and-so can enroll somebody. So given that you have a web portal that somebody can individually sign themselves up, what does enrolling somebody mean?
For the record, this is C.J. Bowden. Dr. Klein, enrollment in the exchange would be actually sitting down and sitting beside a person at the web portal or at your computer screen, walking them step by step through each of the procedures, each of the eligibility, bring it back, tell them what they're eligible for, look at plans with them. Now here's where we're going to do a different enrollment scenario. Licensed producers can sit down and offer their opinion to the person. I have experience with this carrier. I have experience with this QHP, and they can help guide a person, especially if the person has a terminal condition or a chronic condition. That person can look at and say, these plans will help cover your chronic condition better. That's what a producer can do. Moving on to a navigator can sit down beside a person and explain to them coinsurance amounts, the plan, the things that the plan covers. But as soon as that person asks, which plan should I enroll in, the navigator actually has to hand off to a broker. They're going to have to hand the person off to a broker. The navigator can sit down and walk a person all the way through, and the person says, I want plan X in the gold tier. Okay, you're in plan X in the gold tier, enroll. The data is going to be transmitted, they're going to be enrolled. So there's a little bit about two different kinds of enrollment, but that's the scenario where it would be. An outreach specialist is just an educator. They will do no enrollment.
So what can a non-funded, non-health insurance exchange funded navigator do?
Well, they wouldn't be a navigator, and I guess the best way to explain that would be like your neighbor coming over to your house and telling you how to do your taxes. It's going to happen on the outside, but it's not.
So what I'm trying to say, what I'm trying to get to here, I think I'm saying for the third or fourth time, and I apologize for that. If a religious organization, a church, a synagogue, a mosque, as a service to its members, wants to pay to train a navigator to help their members, and that person goes through the 16 hours of training or 24 hours of training, but the health insurance exchange, for whatever reason, because there are many competitors applying for the grant, chooses not to fund this person or that community organization, but the organization says, it's okay, we want to pay this person to help our members. Can they do that? Can they sit beside them and enroll them? Can they not enroll them? What I, again, to reiterate, I'm concerned, especially with the $65,000 number, that we're not taking advantage of community organizations that could help their members navigate through this process, no pun intended, by limiting this to exchange-funded personnel.
Lynn Atkins, for the record, I would be supportive of if anybody in the just for an example, the religious organizations, if they wanted to send somebody to the navigator training and have them certified or licensed, but is not asking for funding to do that, I don't see why that would be a bad thing.
For the record, John Hager. So this can be done either way. The committee has approved the recommendation that you see here. And as you pointed out, Dr. Klein, it includes all navigator participating in the exchange will receive funding through the competitive grant process. The board can change that if it feels it's necessary. The reason that the proposal went forward this way was so that there were two ways to reprimand a navigator if they were not following the rules per se, that they would lose the certification and they would lose the funding. You can certainly be an individual helping somebody else out. I don't know where the line is crossed when you become an organization, but you can certainly help your mom or your daughter or somebody enroll in insurance. So I guess the question is, at what point do you need a navigator certification? Probably when you're helping out people outside of your family. I don't know exactly, but you could also help friends. I'm not sure exactly where that line crosses, but this certainly could be changed to allow navigators that are volunteer navigators, as long as they're certified by the Division of Insurance, as long as we're aware that if they do something incorrect, that at that point the only way to reprimand that individual is to eliminate their certification.
Well, I mean, just as, physicians lose their medical license, lawyers become disbarred, even though we're not paid by the state. That seems to be a pretty good incentive for us not to misbehave. So I would think that losing your certification from the Department of Insurance would be fairly good, a fairly sufficient means.
I want to ask a question, maybe approach it from a different perspective. And I'll ask John and CJ this. If you had the paintbrush to paint what this is going to look like when this program gets going, how many navigators do you think will be enrolled? What is it that you want in the number of navigators?
For the record, CJ Bowden. To give you a broad brush of what the program would look like, one chance or one navigator entity that we would look at would be possibly the Intertribal Council of Northern Nevada. For the Native American tribes that we have in the state, they could apply possibly for grant funding for a mobile computer setup that will go out with them on the road when they go out and travel to all these tribal areas, so they could do monthly enrollments. We're looking at putting navigators where it is by proportion of population. Southern Nevada, Las Vegas, of course, would have the most amount of navigators, and going up into Northern Nevada and then out into the rural areas. I know the outreach will be different in the rural areas, but that's kind of what the program is, in a broad brushstroke, would look like. The funding, as Mr. Hager alluded to earlier, we didn't expect to pay a person a full-time salary all year to be a navigator, because we have open enrollment only for a portion of each year. The first open enrollment is approximately 6 months long, so we're going to have it at that point, and then each other open enrollment is only 2.5 months long. So helping people enroll through that point is not a full-time job throughout the year. That is a little bit of what the budget was written off of. The other point would be, throughout the rest of the year, these people probably have other duties in their work, and they're doing outreach in those different ways.
All right, so let me continue down that path a little bit. So the grant process really is not envisioning individuals coming in and asking to be navigators, but probably, for lack of a better word, nonprofit groups that have an interest in doing this, and the funds are not meant to pay personnel costs, but probably meant to give them infrastructure so that they can go out and help navigate?
Madam Chair, that is very along the lines of what we were looking at when it was set up. To get a navigator grant, you have to be an entity, and that is an entity registered with the Secretary of State in Nevada. An individual could be a sole proprietor, set up an LLC, they could become a navigator, or a group that works with people and does outreach could apply to become a navigator, have people in their organization certified, and they could act as a navigator. This would help with paying the navigator grants. It would help with not having 300 different people to pay. We could only have certain organizations that we pay, depending on size, a certain number of organizations, excuse me, and then going out and doing that type of outreach.
This is Lynn Atkins. So I think we're getting a little bit clearer, I think, on what the big issue seems to be right now. So for the first 6 months, right now, the staff has suggested $380,000 statewide for navigators. So whether it's to help infrastructure to an organization, whether it's for someone to start their own, nonprofit or LLC, that's just $380,000 is just not a lot. And then in addition to that, though, the outreach specialists that we keep talking about, plural, the budget for that first 6 months is $75,000. So I agree with Ms. Johnstone. I think we need to have a better picture of what the plan is implementing the framework and the job descriptions that my committee came up with to figure out how much money really is going to be needed, especially for that first 6 months.
For the record, John Hager, if I might, I think that the framework that the committee came up with is sound. It appears that the board is very uncomfortable with the dollar amounts. And obviously we deferred the training piece of it. So it might make more sense, rather than continuing on a discussion about dollar amounts, possibly approving this document without the dollar amounts and without the training hours, so we can come back with a more sound structure for the rest of it, if that's appropriate.
This is Ron Klein. I'm still not comfortable with the answer of whether a community organization that doesn't get a grant can have a navigator. So, I mean, I think, especially given the budgetary limitations, it would be foolish to not allow an organization that wanted to fund its own navigator not allow it to do so. So I think I'm trying to listen for a clear answer, but I'm not hearing a clear answer if such a person can exist. You mentioned the sanctions that you can take away somebody's funding, you can take away their licensing. I think it's sufficient to take away their license. So my concern, maybe sort of a corollary to the dollar amounts, is that by having limited dollar amounts and not letting organizations fund their own navigators, we're going to hurt ourselves. And I think, and I appreciate that Mr. Hager has to sort of use some model for outreach, but I would say that the first 6 months of this health insurance exchange, everybody's going through the portal, we're enrolling 100,000 people, is going to be more complicated than Medicare Part D, where you actually have your health insurance through Medicare, and now you're just trying to figure out a prescription benefit program. I think enrolling in a whole health insurance package and enrolling through a web portal that you've never done before is a lot more complicated. So I think the concern here is that you need to front load your outreach specialists, your navigators, your help at the very beginning of those first 6 months, knowing full well that 2 or 3 years from now, when everybody's comfortable with what the insurance exchange is, with what the portal is, you won't need that many people. But at the front end, when everybody's trying to figure it out, you need more people. And I think the concern is we're working very hard here to make this work well. But if we open our doors October 1st of 2013 and there aren't enough people to help, there aren't enough people to guide people, then it's going to become a mess. And then all the hard work we've gone to here will be for naught, because the news stories will be, I tried to enroll on the health insurance exchange. I couldn't figure it out. There was nobody to help me. The call center lines are busy. I can't get through.
Dr. Ford, were you wanted to? Oh, okay. All right. Ms. Kerr, is there anything else that you would like to add to this? And I'm going to open it up for public comment.
Nothing further, thank you.
Thank you. All right, Ms. Kerr, would you help me in if anybody up in Carson City would like to participate in public comment on this agenda item?
We have a person approaching.
Thank you. Could we maybe get people raising their hands so we know how many people? I see Commissioner Kipper there. So, is there anyone else other than the Commissioner that would like to speak? Have we got 2 or 3?
I saw 2 hands.
Thank you.
Madam
All
Chair.
right, thank you.
Excuse me, Madam Chair, for the record, Scott Kipper, Insurance Commissioner for the state of Nevada. And I will keep my comments very brief. I think this discussion has really highlighted a lot of the good thinking that's gone on with Ms. Atkins and her committee. Certainly our discussions with the staff at the exchange has highlighted this. You know, we as the primary consumer protection agency for insurance in the state have a very vested interest in making sure that anybody that is dealing with consumers in the purchase of an insurance product is as trained and as educated as possible. Certainly the issues around the exchange are a little bit more complicated because we have Medicaid eligibility, we have the issues around the tax credits that need to be explained, certainly the other pieces around eligibility, as well as the issue that somebody brought up earlier of cultural diversity that needs to be taken into account when you're dealing with consumers. So we believe that whatever the recommendation is from this committee and to the board, take all of that into account. We do already, as it's been well spoken about, provide for licensing of producers. Those producers are well educated to have a significant number of hours that they're required to study before they take a pre-licensing test. And once they take that pre-licensing test, then they are allowed to test for their license. I think the issues around license light or certification highlight the fact that they probably do not need to go through that great of an amount of education, but certainly there has to be some form of education, and as Dr. Klein pointed out, the issues around accountability. So if there is a navigator or a producer, for that matter, that are providing inaccurate or incomplete or otherwise not performing duties of a navigator, there needs to be some way that those individuals can be sanctioned. So we are fully supportive of that. I have deliberately stayed away from getting into the issues around dollar figures, but at $380,000 for the Navigator program, and you're thinking about enrolling at least 100 to 145,000 individuals the first year, that $2 or $3 or $4 per individual is not significant enough to generate a lot of interest from a lot of people to sit down and do that work unless they are volunteers like in the SHIP program who are not compensated from the SHIP program. I believe their money goes to fund the program but not to pay individual volunteers. The issues that Dr. Klein brought up about having an organization sponsor an individual certainly has some merit. I think if there are some people that want to volunteer on behalf of their nonprofit organization, go through the training and provide those services, I think is admirable, and certainly we would definitely support that at the Division of Insurance as long as they met all the requirements of the Navigator. Madam Chairman, with that, I will conclude my remarks and certainly answer any questions that may be there.
Thank you, Mr. Commissioner. And do any of the board members have questions for the Commissioner before he leaves? Thank you. And was there someone else that wished to speak up in Carson City?
She's approaching.
Thank you.
Good afternoon. My name is Elisa Cafretta, and I'm with Nevada Advocates for Planned Parenthood Affiliates. As I've testified before, we have 5 health centers. We see about 25,000 clients a year. So I just wanted to raise two issues, which I believe we've spoken to on several times in the past, but just based on the discussion. One of the questions is about the timing of the grants and versus the open enrollment periods. If you think about the 500,000 folks who do not have insurance, I envision that we will, if we go through and become navigators, I envision we would probably have to talk to our clients maybe more than once before they got to the point where they were ready to actually enroll and experience into the insurance program. And we typically see our clients twice a year, so that is very logical. But when you're dealing with people who have never had insurance, who come from families where there is no experience with insurance, we might need to be thinking about a much longer education process in terms of getting them to that point where they can enroll. So as we're structuring the grants, while there might be a very short window for people to enroll, there might be a much longer education process. Which then brings me to my second point, which is why I am so concerned about the idea that we are going to hand people off from a navigator the moment someone says, "What do you think I should do?" and hand them to a broker. Suppose we've been talking to them for a year or a year and a half. We know everything about them under a HIPAA framework. We've been explaining based on our information with them and our history with them and our trust with them why it's going to make sense for them to get insurance. And the minute they say, "What do you think?" we say, "I'm sorry, you have to call, a licensed broker now." I can't take you any further in the process. I think that is a huge disservice and completely inconsistent with your no wrong door policy and your goal of getting as many people as possible enrolled. And that brings me to my final point, which we have provided testimony on several times. I think the not offer any opinion or editorial standard is, one, unenforceable. I look at the attorney. I can't imagine that. I can imagine a lot of conversations where we might say, "Well, this is good," or "That's not good," or when I went online today, just looking at web brokers to see what happens when you put your name into e-insurance, it came back, it gave me 77 policies that I could possibly be eligible for. So if I was sitting next to somebody and said, "Well, let's narrow it down to 10 to look at," is that editorial? By saying let's look at the middle 10 or the least expensive 10, is that an editorial comment? I think it's a very difficult standard to enforce. The federal guidelines, as we've documented, say that navigators must provide information and services in a fair, accurate, and impartial manner. So I would recommend that you reconsider the language of not offering any opinion or editorial and use the federal guidelines in their place to provide some protection to navigators, and also to allow them to continue what may be a 6-month or a year-long process with somebody and actually get them enrolled. So that's what I wanted to provide for you today. Thank you.
Thank you for your comments. Do we have anyone here in Las Vegas that would like to participate in public comment? Okay, there are none. How about on the telephone? Okay, it doesn't sound like we do. Ms. Edkins.
Yes, can we just have a moment here, please? Mr. Hager's looking something up.
Okay. Why don't we take a 5-minute break here, because the document that he's looking for is not easily accessible. So we'll come back on the record in 5 minutes.
look at what we...
All right, let's go back on the record.
They're not going to do all of it. They're going to do a third of it.
Thank you. Mr. Hager, would you address that one point?
For the record, John Hager. So one correction on page 5. The last bullet point on the list for the roles and responsibility of navigators, it reads, the enrollment navigators must not offer any opinion or editorial on the QHPs in the exchange. That statement is correct based on the discussions that we had with the Division of Insurance and at the committee level, that we expect that navigators must not offer any opinion or editorial on the QHPs in the exchange. That was put in place because we cannot require a navigator to get errors and omissions insurance. So a producer is allowed to have errors and omissions insurance, and therefore when they have an opinion, they're backed up by that insurance. Navigators don't have that, and we need to make sure we limit that liability as much as possible. It is very difficult to enforce, we realize that, but we need to make sure the training is there. We need to make sure that we audit them properly. The reference to that reference 17 there, 45 CFR 155-210, that's not quite the right reference for that. So I would delete that reference to eliminate any confusion. But I did want to point out that it's the errors and omissions requirement that requires that we not let navigators provide opinions. Now, one additional comment. Just because somebody asks for an opinion, which one should I roll and what do you recommend, doesn't mean we have to send them right then to the broker, the producer. It simply means that the navigator says, well, I can't answer that for you, but do you have some criteria? Is your doctor covered? What doctors do you have? Well, okay, your doctors are covered under these plans because that information can be found in the web portal. What drugs do you take for your chronic conditions? Well, that information can be found in the web portal, so we can eliminate certain plans. They simply can't offer advice. Okay, I've got my 3 remaining plans. Which plan is the best plan? What would you do? They can't answer that question. And at that point, rather than sending them to a producer, they have to say, I can't answer that question because I'm not allowed to provide opinions, so you'll have to make that decision for you. If you would like advice from somebody, I could transfer you to a broker at that point. So it's not that it's required to go on. It's not required that they leave the navigator, but the navigator needs to know what their boundaries are.
Madam Chair, may I make a motion?
Yes.
Lynn Atkins for the record. I move that the board approve document 7B entitled Navigators, Producers, and Outreach Specialists with the following changes. 4.4, navigator compensation. It is, we add there that individuals or entities can go through navigator certification or licensing through the Division of Insurance, as will be defined later, but does not need to have a grant in order to work as a navigator through this program, and that we defer the outreach specialist compensation training and the navigator compensation and training requirements portion to the next, and the producer training to a future date.
All right, let me ask one question before we have a second. Is it that you want to eliminate all the criteria in the training or just the hours within it?
I think at this point all of it, because I don't even know that that exact list is going to be the list. So I think we'd just rather defer all of those decisions to a later date.
Okay. Thank you. Is there a second to that motion?
Well, I guess one question first. So outreach specialists, those are going to be, there's going to be health insurance exchange funded.
Those can be funded by the Affordable Care Act, yes.
Could a community group have their own outreach specialists? Same question as navigators.
I don't see any reason why
I
don't think we can limit the free speech of an organization.
Okay, so there's nothing here in this document that says an outreach specialist has to be employed by the health insurance exchange.
What this document says is that they will be employees, contract employees, or contracted entities, I believe is what I saw in here. Any organization can provide outreach and help to their constituents, the people that they want to help. What this defines is an addition to what we currently have on staff. The board has approved a staffing plan that has 13 employees. This allows us to add additional resources to get the word out. And so the definition of outreach specialist, it might as well just be an entity that is helping us out and then we're paying for them. So anybody could be an outreach specialist, but it's not, they're not recognized, they're not trained by the exchange. So
6.3, outreach specialists will be, as you said, employees, contract employees, or grantees of the exchange will be compensated with funds derived from the ACA Level 2 establishment grant. 6.2, outreach specialists will be trained and certified by exchange staff. So, again, that same question of the navigators. Could somebody come and get training from the health insurance? Because, and again, it's not that health insurance exchange is a bad group. It's that you run out of money. And here's this organization, we want to go and be outreach specialists. We want your training. We understand you can't pay us. It's okay. We'll pay for it ourselves. It's important enough for us to do this for our community. Sort of same question, navigators.
This document does not limit our ability to utilize volunteers in the public. And so whether we call them outreach specialists, it doesn't really matter. We can...
John?
Yes, ma'am.
Shauna DeRoos, for the record.
Go ahead.
This document specifically states that outreach specialists will be employees, contract employees, or grantees of the exchange. If we want to add volunteers to that list, I think it would open it up to what you are discussing there. But I think currently, as written, it is very specifically constricted.
I would add another amendment to my motion that volunteers be added to that list.
And I will second the amendment and the amendment to the amendment.
This is Marie Kerr. Madam Chair, we should be very specific.
Yes, ma'am.
I'm sorry. We should be very specific about which portions of this document we are deferring. For example, I don't know, page blank, paragraph blank, just so we have a specific thing on the record about what we've voted on and what we've deferred. I think staff may appreciate it. And anyway, thanks.
Thank you. Very good comment. So, Ms. Atkins, can we go through each one of the sections with you?
Yes.
Thank you.
Okay, so I'm going to start with 4.0 because everything before it is just kind of a preamble. So we are approving 4.0. We are approving 4.1. We are approving 4.2. We are deferring 4.3. We are deferring 4.4, but although isn't. We are deferring the dollar amounts in 4.4, so that last paragraph, but we're also going to add here that navigators do not need to have grant funding, but they must go through the Division of Insurance, either licensing or certification as defined at a future meeting. We are approving 4.5. We are approving 4.6. We're approving 5.0. We're approving 5.1. We're approving... We're approving 5.2 without the hours. We're approving 5.3. We're approving 5.4. We're approving 6.1. We're approving 6.2 and adding volunteers. Oh, I'm sorry. No, we're approving 6.2. We're approving 6.3, adding volunteers, but not approving the second paragraph with the budget. We're approving 6.4.
All right, and then that is a motion by Ms. Atkins and Dr. Klein. You made the motion, the second to approve.
Yeah, I would second the motion, and I don't know if it's in order, but perhaps since this is complex, and we haven't agreed on final verbiage, that maybe to have Mr. Hager bring the final document back for approval next month, if that's okay with everybody.
Marie Kerr, we probably should defer.
Yes.
I'm sorry. We probably should defer under 7.0 summary the budget items where they have specific numbers.
Yes, that's correct. Thank you. Mr. Hager, what is our timing on this? It does, would you prefer to
Probably a good idea.
bring this back as a cleaner document with the changes that we've discussed, and we can vote on it at the next meeting?
For the record, John Hager, yes, we could certainly vote on it at the next meeting if that is the board's pleasure.
So do I need to withdraw my motion?
Mr. Belcourt, what is the best procedure on this?
Withdrawal would be the best procedure.
Thank you.
I withdraw my motion.
I withdraw my second.
Is there another motion then to defer?
Move to defer to next meeting and ask staff to update the document with the proposed changes.
And I add my second.
Okay. Any further comments? Okay. All those in favor of the motion?
Aye.
Any opposed? All right. Thank you. The motion carries. All right, next item on the agenda is still under agenda item number 7, and we are moving to reinsurance and risk adjustment. Oh, I'm sorry. Okay. One more thing for you, Lynn. I'm sorry.
Yes, I know, and Mr.
Go ahead.
Hager has graciously agreed to present the web broker discussion.
So the Consumer Assistance Advisory Committee discussed whether or not to allow web-based brokers to enroll individuals on the exchange. The recommendation that we just talked about recommended that all brokers be allowed to participate on the exchange. However, a distinction needs to be made between a broker who is assisting somebody from off the streets and they are coming in and utilizing our system to help somebody, and a web-based system that is basically a separate exchange. Now, you can't enroll an individual in a qualified health plan with the advanced premium tax credit or cost sharing reductions outside of the exchange unless we approve a web-based system. And when you do that, you introduce a bunch of administrative complexities. For instance, that web-based broker has to follow all of the requirements of the exchange as far as display of information, communication, marketing, all the things that we have to abide by, that web-based broker would have to abide by. Basically, you've got a rules engine that determines who is eligible and who's not. And on top of that, you have our web system, our web portal, the BOSS system we call it, the Business Operations Solution. And if we were to add web-based brokers, it would be one layer on top of that where we would have to create an IT infrastructure that communicates between our systems and that web-based broker to make sure that when that person, number one, that person goes online and they can see all the options that they could otherwise see on our exchange, and number two, when they enroll, they can return that information back to us, and then we have to send it in all the different directions that we have to send it. So the committee's recommendation was to not allow, at least for the first year, was not to allow the web-based brokers to enroll individuals in the exchange. Now, an entity that is a web-based broker who has brokers on staff could still enroll individuals as long as they're using our system. So this doesn't prevent a broker in an organization like that from enrolling people. But what this would do is allow the exchange to proceed without the additional implementation of all the technical requirements and all the administrative requirements that would be necessary to regulate web-based brokers. There was a report that was included that was referenced that talked about the web-based systems that are out there and their the populations that they serve. It was 1 to 3%. I can't remember exactly what the number was. I believe because of the complexities, the IT complexities and the administrative complexities was the reason that the Consumer Assistance Advisory Committee voted to recommend that the board not allow the participation of web-based brokers.
May I ask a question? I guess Mr. Hager. If we set up our web-based portal and there's a web-based broker, then it's not our responsibility for the IT system to comply. It's the web-based broker's responsibility to have their system comply with our system. So it's really not, if I understand correctly, it wouldn't be our responsibility; it would be theirs. We're the system, and they have to work within our system. And then the second question, is there any kind of legal ramifications for discriminating against web-based brokers versus people-based brokers?
For the record, John Hager. A couple of things. First of all, while that entity would have to comply with the regulations, my understanding is that because if a state were to choose to allow web-based brokers to participate, it would be incumbent on the exchange to regulate those insurers and ensure their compliance. So even though they're required to make sure that they follow the rules, we have to confirm that they're following the rules. Secondly, yes, it would be incumbent upon them to make sure their systems work, but the communication is a two-way process, and so we have to have a way to communicate our information to them and then receive the information that they communicate, and that becomes fairly complex. It's an additional project on top of this already complex implementation. As far as the legal ramifications of not allowing the participation of web-based brokers, I'm not sure exactly what they are in relation to all the other rules and regulations that might be out there in the universe. But the Affordable Care Act, very specifically, in the discussion about brokers, makes the participation of web-based brokers optional.
Do we have any other questions? Ms. Lewis, anything from you?
No, not at this time. I remember the discussion very clearly about this, and I think that the committee recommended that we at least defer, any inclusion of web-based brokers for at least a year, not have them the first year.
Okay, thank you. Ms. Kerr, anything from you or any of the other board members there?
No, thank you.
Okay. Nothing here, then. I would go ahead and, yes.
Lynn Atkins, for the record, I move that the exchange does not allow enrollment in qualified health plans, advanced premium tax credit, and cost sharing reductions through brokers' web-based systems.
Do we have a second?
This is
Thank you, Ms. Lewis. All right, all those in favor of the motion?
Aye.
Aye.
Any opposed to the motion? Thank you. The motion carries. All right, we've got risk and reinsurance and risk coming up. Did any of the board members want to take a break till about 3 o'clock, or do we want to move on? Keep going? Okay, we'll keep going. Ms. Johnstone.
Thank you, Madam Chair. Leslie Johnstone. The Risk and Reinsurance Subcommittee had previously made the recommendation on the risk adjustment program to defer to the federal program. And at our last committee meeting, we had a report from the Division of Insurance, which is included in the packet. And I would suggest, if anybody's interested in this topic and has not read the report, that they do that. I do think it was a pretty clear pro and con on each of the different options that are in front of the state. So the remaining item really that is up to the state still to decide is the reinsurance program, which is a temporary program, runs 2014 through 2016. And at the last subcommittee meeting, we had a presentation from the Division of Insurance, and I believe we are meeting at the end of this month in the anticipation that we'll have further direction or a clarification from the federal government on what their plan would be so that we could have a final recommendation about whether or not to recommend to the Division of Insurance whether we defer to the federal program or if we recommend to the Division of Insurance establishment of a state-administered program. So we'll have to bring this back after we have that final meeting. And I know that the Division of Insurance is having, as part of their community meetings, discussions about this program as well. So with that, I'll take any questions, Madam Chair.
Do any of the board members have questions? Okay. What is the pleasure of the board then? No action necessary on this? Okay. All right. All right, thank you. Well, that looks like we've concluded agenda item number 7 then. Right? Is there one? Okay. So let's go back to agenda item number 6 that we put on hold until we have the discussion regarding the funding for navigators and outreach programs. So I'm going to open it back up for discussion and probably ask Ms. Atkins, since she asked us to hold on this, if any other discussion.
Well, I guess I just, I don't know, I'm assuming there's some finite amount of money, and if we need to be concerned about designating some of the money right now in anticipation of maybe needing a lot more than was budgeted for the consumer assistance portion. So it's just a question.
I have a quick question. With those numbers that Ms. DeRoos quoted, are these agencies under retainer? So we're not putting out any money we're just entering a contract with them that we may use them, correct?
That's correct.
And who ultimately is in control of that money?
The exchanges.
So all of the money spent would be with board approval or with?
No. So the contract, what this contract does is gives staff the ability to assign work to one of the 3 vendors through a work order process. And that's how we've been doing it with PCG, RL Carry, and Aon at this point. We create, every time that there's something we need to do, for instance, figure out how much we need to spend for navigators, we would create a work order, give them the scope of work, talk to them about what would be a reasonable amount of time and a reasonable amount of money, and then we agree on a cost not to exceed at that point so that there isn't scope creep and there isn't these huge increases in dollar amounts. The work order process has significantly decreased the amount of money that the exchange spent on consultants. If you look at the bills in the November, December, January, February timeframe, the exchange was spending $100,000 to $200,000 a month. Starting in March, April timeframe, we reduced it to $25,000, $30,000 a month. So, and that was a combination of the work order process and also having a better handle on the exchange requirements and getting into the weeds and everything and making the networks with the other states that are implementing so we have a better idea of what's going on. So this simply provides us with a pool of vendors to ask questions of. There are times when it's convenient to have 3 vendors. You ask the same question to 3 different vendors because they have contacts in different states, so you can get a better pool of answers. But for actual work, there's very specific requirements on how that money is spent, and we're very careful about how we monitor that.
Thank you.
And I have one other question. So is it hourly? Are we paying them all hourly, or is it by project? How does that work when you say you need a project done, and if you submit it to all 3, do they just bill you hourly, or?
The proposals in the contract has an hourly rate for the various types of employee for each of the vendors, and so each project has a cost not to exceed. They bill by the hour, but if they agree to a contract and they hit that cost not to exceed, then they don't bill us any more than the cost not to exceed. So they have to finish the project in the agreed amount money. So it's kind of a combination of both.
Levon Lewis, I don't remember how it was proposed that we were going to secure the funds to pay the navigators, since we couldn't pay the navigators from federal dollars, if I remember correctly. So could you just explain that to me, please? And will any increase in the amount of funding for the navigators tell me how we would cover that?
For the record, John Hager. So the navigator budget, we're going to go back and figure out an appropriate navigator budget. That should not affect the consulting contracts. Right now, we are actually without a consultant. It was, with all the other things going on, it was difficult to get an RFP out and done in time for the, I guess it would have been the September BOE. So this is going to the November BOE. If this is delayed again, then it would be the December BOE by the time it gets to the board. So it'll be 2.5 months without consultants. And, you know, we can survive, but it would be helpful to get the consultants back on board so that we can assign them work if necessary. As far as the navigator budget goes, again, we'll bring that back at the next board meeting with a more appropriate budget. Oh, I'm sorry. Yeah, the fees. So the navigator funds cannot be paid for out of the ACA grant.
Right.
So if we determine that we need to increase the navigator budget, then we will either need to increase the fees that will be charged to the carriers in at least the first year, or we need to realize that we will have a lower cash reserve at the end of the first year.
Thank you.
All right, so what we have under discussion right now is ratification of these consulting and actuarial vendors that have been selected. There are 3 of them. If the board approves it, then Mr. Hager has to take it to the Board of Examiners for further approval, for final approval. So are there any other questions, or what is the pleasure of the board?
Madam Chair, this is Leslie Johnstone. I would move approval of the recommended levels for consultants.
All right, do we have a second?
Marie Kerr, second.
Thank you, Ms. Kerr. All right, all in favor of the motion?
Aye.
Any objections to the motion? All right, we have approval of agenda item number 6. All right, so going back to agenda item number 8, which is the staff quarterly reports. Are you doing this, Mr. Hick? Okay. Mr. Roos, are you doing this portion of the meeting?
I think this will be a combination of the staff here to give the staff some experience with the board meeting, if you don't mind.
No, that'll be fine. Thank you.
Okay, so we're going to start the report off with the financial report, and Ann Scott, our Finance and Research Officer, will start us off.
Thank you. Ann Scott for the record. In your packet you will find we've provided a financial report for the quarter ending September 30th. This quarter marks the first quarter, the beginning of the state fiscal year. Since the closing of our state fiscal year 12 budget, DWIS, Welfare Agency, has fully expended their Level 1 grant authority with the Eligibility Engine project and ramping up with that. And also, in our last report, we also let you know about the GovChat, and they continue to spend their authority, and we're expecting to get their first quarter bill soon. And at this time, we don't see that the exchange has any funding issues. And in the chart that's provided to you, you'll see that we've changed it a little bit from prior reports, and we go across the top listing all of the revenues that we currently have authority for in this current state fiscal year. And then below that, we list all the expenditures and then show you total expended year to date and the percent that's expended through the report. And that's all I have. Are there any questions?
Thank you, Ms. Scott. Any questions from board members to Ms. Scott on the financial report? All right, thank you for your comprehensive report. Let's see, Consumer Outreach Report.
For the record, this is C.J. Bowden. In the third quarter of 2012, we made 7 presentations to approximately 400 individuals in the state of Nevada. 3 of these presentations were in the South, and 4 of them were in northern Nevada. Our outreach efforts are continuing. Most of these were on a invite basis. And as Mr. Hager mentioned earlier, our RFP for marketing and advertising services for the exchange is on the streets, and we expect that contract to go to the January BOE. I'll entertain any questions if anyone has them.
Any questions? All right, thank you, Mr. Bowden. And who's doing IT implementation?
This is George McNeil for the record. Since approval of the Xerox contract in August, the team, including choice administrators, KPMG, and Thomas, has been participating in system development sessions with staff from the Exchange and the Division of Welfare and Supportive Services. Xerox has established temporary offices up in Reno, with plans to move in Carson City as soon as space is leased and available for the move. The first contract deliverable has been accepted by the Exchange. In fact, we've accepted a couple more since this has been written. The additional deliverables are arriving almost daily and are under review. Meetings are taking place on a weekly basis with our partners, DWSS, for the eligibility engine, and we are meeting almost daily with Xerox today. And that's my report. If there's any questions.
Board members for Mr. McNeil? Yes, Dr. Klein.
Just one question, and I don't know if this is appropriate for you or Mr. Hager, but where are we in terms of the IRS real-time turnaround of information, since you can do great work here, but if the IRS falls down, it's not going to happen?
We're discussing the federal hub then. We are still waiting for the CMS and those folks to go ahead and give us final approval. They have not. They're still programming the federal hub, so we're still waiting for those specifics to come out to us. The only thing they have up today is a test system, and it does not have any data in it. The best we can do is connect to it.
So what is going to be the anticipated turnaround in 2014? Is it going to be real time in a few seconds, or is it going to be a day? Or and I know I'm asking a question that you can't answer, and I'm probably going to get audited, but I mean, do you have any sense of what the anticipated turnaround time will be in 2014?
We'll make sure we send those records to them. No, and at this point we do not have anticipated turnaround.
So I guess my question is it going to be a real time? Are we anticipating a real-time thing where you're at the computer with a web portal and you're enrolling with your navigator and your outreach specialist and your producer, or is it that you try to enroll and the computer says we'll get back to you in 2 days once we verify citizenship, income, and all those things?
Best case scenario is yes. It'll be a very quick turnaround. In today's environment within DWSS, the SSA and IRS are both very quick turnarounds when they do the batch processing in the evenings. So we are anticipating that they will have a quick turnaround. Again, until they tell us what they're going to be doing, I cannot answer that question.
If I could just follow up, sir. For the record, John Hager, we are going forward with the assumption that the turnaround time will be within seconds, 15 seconds, 30 seconds on the outside. If it gets to be much more than that, then we are going to have to rework all of our processes. We will likely have to rework our contracts, our grants. I mean, everything will have to be rethought if it's a nightly batch process. So right now, the only thing we can do is assume that they are going ahead with the intent that everything appears to be that you will be able to do real-time enrollment. But if that changes, it's going to require massive reworks, and we'll have to go back to the drawing board.
Thank you. Any other questions for Mr. McNeil? All right, thank you very much, and it's nice to have all of you giving your reports. That'll close agenda item number 8. For item number 9, do we have any discussion on dates, times, and agenda items for future meetings? Does not sound like there's any on that, so we will close that agenda item and open it up for public comment. Is there anyone in Carson City that would like to participate in public comment?
We have an individual approaching.
Thank you. Please identify yourself for the record.
For the record and for the comments for the record, my name is Peggy Learbowen, and I'm a citizen and I'm a retired person utilizing the state PEB program, and I wanted to issue you a cautionary note in regards to the insurance exchange and what you might be doing within the state of Nevada. Thank you for bringing the money back to Nevada. What the note is, the program that is now in existence has received a vote, Mr. Wells has received a vote of no confidence from an employees group. We had an independent audit that was reported back to us just this last meeting of the PEB board that said, no, everything is not fancy and dancy in heaven, that over 50% of the people are totally dissatisfied with how it has functioned. There has been testimony where people have talked about having heart surgery and having stents put in, and the medication to keep the stents open. Under the present program, the way it's working, they can't afford the medication to keep the stents open. We've been told where there had been an approval for a kidney transplant that the call had come in, the kidney was there, and the call came that, by the way, we're denying it, and you'll have to go and do this over again. They didn't have to worry about expending funds there because the person died. I caution you with every piece of caution I know how to take a look at how the program is working that's in place for PEB, and so that no mistakes are made again, because I think you're trying to do the right thing to make sure people have insurance that they can use and not just catastrophic insurance with the humongous deductibles. These are things that I can only please and beg you to be very cautious in this activity. I would hope that the best for the people who have done well for you in the state and to others that you will reach out to, that you will be, in fact, doing the best you can for them. One insurance group that the folk up north really liked working with was the Senior Care Plus. We had to work to get them added, even though they weren't advertised as being available. These are all these little mistakes. It's not the affair that causes the divorce. It's the nylons hanging in the bathroom all the time. And so please, please, please watch the details. And thank you for all your hard work and putting in the time that you're doing. But take a look at what is, what has been, what did work, and I say that cautiously, and what hasn't worked, because it's cost people lives. And I love you for being here, and thank you very much for the time today.
Thank you for your comments. Any other people from Carson City? How about here in Las Vegas? Here in Las Vegas? Anyone on the telephone? All right, I thank everyone for their participation today, for preparation and all the advisory committee work. Job well done. And with that, we will adjourn the meeting. Our next meeting will be November. I think November 8th. November 8th. All right, at 1 p.m. So thank you all.